I'm Jen C. and I live in Texas. I have pulmonary arterial hypertension, or PAH as some others refer that to. Most often I tend to refer to my pulmonary hypertension as PH. So if you hear me saying PH or PAH, you'll know why. A lot of times people use those interchangeably. I was diagnosed with PAH in February of 2005, so this year was 16 years, much more than I had originally was told when I was diagnosed back in 2005. Unfortunately, there was not enough research and education out there. I was told that pretty much to go home and get my life in order, and I would be gone in about three years, 5 at the max. So I am sharing my journey with others. I would like to talk a little bit about the impact of COVID-19 and what it has had on my PAH and also affected those in my family. Unfortunately, back in November of 2020, I was diagnosed with COVID-19. My husband, essential worker, most likely called it from work, so he also had it at the same time. But unfortunately for me, with my PAH and other complications related to that, I had to be hospitalized after I was home a little over a week. That impacted myself and my family quite a bit because I ended up in ICU. I was not expected to make it out of the hospital alive. It was very impactful for myself, my family, and I know that many others with PAH are impacted in so many other ways, either by isolation, which I dealt with pre-COVID and then again post-COVID and still today, and also the other issues I think were probably just trying to find out what I could do and couldn't do and the extra precautions I need to do, or was I taking enough precautions, things like that. Those were the problems that I had related to COVID, and I think that was what impacted myself and my family the most during this COVID pandemic. When I think about what was the most challenging for me during this whole pandemic and continues to be challenging, I believe would be that my recovery post-COVID, also being at the hospital, waking up after weeks in the hospital after Thanksgiving. First, I realized that when I missed Thanksgiving and where was my family, where was I at, what happened. I had no clue what my body had been through. The doctors started telling me when I was awake about 2 days before I came home about all the complications that I suffered from COVID related to my pulmonary hypertension. Mentally, emotionally, physically, it has taken a toll on my body, my mind, my overall well-being, as well as those within my family. Not being able to connect with them, to talk to them, I woke up not knowing who I was in ICU. Everybody had to tell me things. Thankfully, I recovered slowly as I came home. I'm not fully recovered now. It's over 6 months now since I've had COVID. I'm just now going to increase my PAH meds again tomorrow after talking with my doctor yesterday. But one of the major challenges I also think is with the doctors. The doctors also and myself, we can't figure out, is this going to continue, or is this going to get better? Is this more related to long-term COVID? Is it truly worsening my pH? Because it has is showing on tests, as well as my symptoms continue to increase. I think that I'm pretty sure those challenges have been the biggest struggle for myself and my family. I know others in the PAH community have been impacted, and the challenges that so many have had, they have not been able to get to their doctor's appointments, of course, and get tests that we need to have done, that we usually do. I usually see my doctor at least every 2-3 months at the max. I go with seeing them. That's the longest time usually. So I was at quite a while, except the time I was in the hospital, of course. They saw me quite a bit there. The greatest challenge for me, I would definitely say, was my overall mental, physical, and emotional well-being, and the toll that it took on my body throughout this recovery, and continues to. I am slowly recovering from certain side effects, but I continue to have a lot of side effects related to the COVID that I had back in November. I think what has probably helped me the most through COVID and the whole pandemic, first of all, I need to say that it would be my supportive spouse. My husband, although he did have COVID at the same time, he was waiting and ready when I was discharged. He was here for me when I couldn't walk, I couldn't feed myself, I couldn't drink from a straw. He was here to help me do those things. I was like a toddler when I came home. I believe if he could breathe for me sometimes he would. He's tried. I definitely think that's so important, to have a supportive team behind you, no matter what, obstacle you're going through, but definitely through this COVID pandemic, and living with PAH. Also, I cannot go without saying that my awesome medical team and all of my healthcare providers have been amazing. I put my life into their hands and they entrust them with my life, so it should be that way. I am beyond grateful to have such a medical team that I can trust with my life. If something I feel like is not wrong, I ask them. I speak up, and we have that type of relationship. So you need that respect. You need that, someone that's going to fight for you. You need someone that's educated in PAH, and knows the most recent updates, the medications, the trials, everything. And I have that, and I'm so very grateful for that. That has really helped me through this. I don't know, I can't say that enough about them, as well as everyone that was at the hospital staff when I was in there for so long. When I was discharged to come home, I didn't know everyone, but they knew me. I was cheered down the hallway to go home. From housekeeping to dietary to techs, nurses, charge nurses, unit nurses, doctors, so many faces and people. It was very touching, to say the least. I definitely cannot appreciate them enough. And I also know that having my medications available and call and being able to deliver on time through the specialty pharmacy, that has helped, because previously the specialty pharmacies that I have had some issues. So to have that during COVID, this was like a security blanket. I knew that I could depend on them just like I could depend on my husband and my healthcare team. They say it takes a village, but it does. It takes a village to take care of a chronically ill patient, with those such as with PAH and things also related to COVID, adding on to that. It just complicates things even more. But I can't say enough about them. My family, my friends, my neighbors, my PH friends, everyone has been really a part of my recovery, and these things have helped me. I also have been able to call and get my oxygen machine changed out, because as you can see, I'm on oxygen tethered to this here 24/7. Pre-COVID, I was on a lower rate of oxygen, and I also was only on it at night as needed during the day, mainly up when moving around. So that is a big change for me, but I was grateful to have them be able to bring me a larger concentrator that would work for my increased oxygen needs. I thank everyone together working on that. Those are some of the things that have helped me get through this, and also a positive attitude. If every day may not be the best day, but it can be a good day. And if not, you don't think everything's that great, tomorrow is a whole new day. I'm just grateful to be here, although I'm continuing to recover and struggle with complications and progression of my PAH related to COVID. I am very thankful for my healthcare team and all those who continue to help me as I recover.